Hello, everyone. Welcome to another edition of empowHER Conversations by empowHER India, co powered by the Filmsters. My name is Disha, the Communications Manager at empowHER India, and I'll be the moderator for this conversation on a very important topic, that is the importance of bone health in adolescence. Before we start the conversation, I just want to tell you a little bit about us. empowHER India has been working for over 30 years to empower women and girls in rural communities. We focus on essentials like sanitation, education, and life skills, but more than that, we are about creating opportunities for women and girls to thrive. And this series, Empowering Conversations, is one of the ways we bring important conversations or topics to the forefront. So, coming back to the conversation that we are having today, that is the importance of bone health in adolescence. It said that 90% of adult bone mass is built by 18 years. So that makes adolescence an age that is extremely important for lifelong bone health. So today's conversation is about empowering teens with the right information to build stronger bones through nutrition, exercise, and stress management. We are going to bust myths, share tips, and start the conversation so teens, parents, and educators can work together for a healthier future. And to help us put together all of this and to understand this better, we have Dr. Chirag Manwani, a limb construction fellow at Hull Royal Infirmary teaching hospitals at UK. With an MBBS and postgraduate training from Mumbai, India, he has been practicing orthopaedics since 2015. Having worked in both in India and the UK, he brings a wealth of experience from two distinct healthcare systems. His expertise includes complex trauma, joint replacements, and advanced limb reconstruction techniques such as deformity correction. And along with him, we have Sohini Mitra, Chief Enabler at the Filmsters, a storytelling powerhouse. She's all about power of media and films to break stigmas and drive social change. Thank you so much, Dr. Chirag and Sohini, for joining us.
Thanks
Thank
a
you,
lot.
Disha. Thank you for the lovely introduction.
Yeah. So I would like you, Sohini, to start off the conversation and, just help us put this all together so that we can have a fruitful conversation. Yeah.
Sure. So, Chirag, thanks for coming and being a part of this entire journey with us. So, bone health is something we all have, right? And the growing years are very important. Like, I've got two kids, you know, both of them. And
Mhm.
the elder one who's 14 years old, the kids who are in their teens, who are crossing puberty age or getting into the puberty age, how do they take care of their health and their bones, especially?
So, Shuri, to start with, I want you to know that why is this phase so important? The pre-teens, teenage, and the growth spurt. Like females usually have a growth spurt when they're between 12 to 14 years, and boys have a growth spurt between 14 to 16, slightly later. It can be a bit variable, of course. But when you have this growth spurt, this is the most important period when you're actually gaining your height and gaining something called the critical bone mass, which just shapes, which like a staying like laying down a foundation for your future years in terms of your bone health. Now, you have dietary components, you have exercise components, you have sunlight, you've got multiple issues which we need to tackle. But considering Indian healthcare and Indian society systems, the urban population and the rural population have different challenges. Like in urban population, not you still have the quality of life and the affordability. We have less incidences of nutritional issues. There are separate issues when you have lack of nutrition, and in rural population you have adequate sunlight but lack of nutrition. And in urban population, because of our activity level, technology, computers, we are less exposed to sunlight. So, but both of them are equally important, along with dietary intake of calcium, vitamin D, proteins, etc., and physical activity. So whatever you do in this age group and the adolescent age group is actually what you can expect in the future as well. Yes, you do have a chance to correct it in the future as you grow older, but it's like the best way time to start is when you're in your adolescence.
Okay, and between the genders, between boys and girls,
Mhm.
is there a difference when it comes to bone health?
In adolescents, not that much. In elderly, once females cross are approaching menopause or after that, then yes, because the female hormones called estrogen also play a role in maintaining your bone mass. Once you reach your menopause and the estrogen comes down, and then that's when your bone mass starts decreasing quite rapidly. That's why the calcium, vitamin D requirements can change. but in the adolescent age group, not that significantly.
Makes sense, makes sense. So, Dr. Chirag, you had spoken about like the dietary components in terms of when we are talking about urban and rural,
Mhm.
population adolescents. So, what are like some of the things maybe that the adolescents should look into in terms of the dietary structure? Is there a diet that they should follow for a good bone health?
So, I mean, as you know, you must have heard this from hundreds and thousands of times from the pediatricians or doctors or people while growing up. It's a balanced diet, right? None of us are new to this term, a balanced diet. But what does that balanced diet entitle? Basically, you need to, as I said, the three important sources. What you're looking at is calcium, vitamin D, and proteins, right? In terms of only bone health, yes, you need other vitamins and carbs as well. But what are three of the most important stuff are calcium, vitamin D, and proteins, right? So dairy products like your milk, paneer, curd, these are rich sources in calcium and in little bits of proteins as well. You also have your green leafy vegetables, methi, sarson, spinach, etc. And you got your meats, chicken, egg whites, very high source of proteins. You also have like vitamin D, unfortunately, is not that high. It's richly available in diet. That's more of a early morning sunlight source. That's why you see every 1 in 3 people have low vitamin D. And along with that, standard like your basic stuff like nuts, almonds, till or sesame or chia seeds, they're also very high sources of calcium. As long as you're incorporating all of this in some amount in your day-to-day activity, day-to-day lifestyle, that's good enough. Oh yeah, along with exercise, of course.
So sitting, see, one thing we have seen that okay, the schools really, encourage kids to do
Hmm.
PT and exercises, maybe games and stuff
Yeah,
like that. But one thing is then that the kids have to sit in their class for hours. Like they,
yeah,
school starts at 7:20, it gets over at 12 o'clock. उस टाइम के बीच पे आई थिंक ओनली हाफ एन आवर दे प्ले और दे get up or do
yeah.
something. So what do you suggest, what should they do even while sitting so that it will support for a better bone health?
In terms of long school hours, first of all, what lays of you're sitting for 10 hours, for example, 8 hours in the school, 8 or 9 hours, right? Some people you'll often find kids coming back home and saying, "Oh, I've had back pain all day," or when I come back, they're extremely tired, they're lethargic, they don't want to play. Yeah, school does take a toll on the mental stress as well. But while sitting, you really can't do too much because you need to focus on the academics as well. Okay, but when you're not in school, you can do a lot of things around it that can help you focus more, and because that 8 to 10 hours are equally important for your growth, mental growth as well, not just your bone health. So it's what's important is not just what you do when you're sitting, what you're doing when you're not in school. That's also equally important. So at least in school, when you're sitting for 8 hours, you don't really have a choice in that, do you? So that time you can just focus on the academic part, and you can focus on your bone health during the remaining part of the day. Yes, exercise is extremely important because there's something called the Wolff's Law, which we say in orthopedics. Like if you don't stress your bone, it doesn't strengthen. That's why all our patients, whoever we operate, irrespective of the age group, we want them to be on their feet as soon as possible. Because if you don't load your bone, if you don't do your exercise, if you don't do your physiotherapy or rehab, your bones won't recover to the optimum level as you want it to. The same is for the kids as well. If you don't do your exercises, if you're sitting in all day, even after coming from school, for example, you're sitting at home just watching telly or staying indoors, just being on
Play
your laptop or
games.
social media. Yeah, absolutely. Or just PlayStation or whatever. Your bones are never going to get stressed enough. Even though your body, your bones do have the potential of suppose X height, you might not be able to reach that, or X bone density strength, you might not be able to reach that because you're not stressing it enough.
Dr. Chirag, like a follow-up thing on this, Empower India works
Yeah.
in the geographic of rural Maharashtra and Raigad. So we are
Mhm.
working with kids who like walk for say 2 hours. Majorly, if we talk about like Adivasi students who going to the
Yeah.
school, they walk about 2 hours one way to in through the mountains, through the jungles, and then reaching the school. So,
Mm.
when we're talking about adolescents, I feel like if we compare it with the urban student population, they are using more energy, and if I put it in a very simple way, उनका bones जो है वो ज्यादा use हो रहा है, as in उनका चलने में या फिर जो भी है
Correct.
usage ज्यादा है. So does that affect their growth or the density of the bone, or does the overuse kind of weaken it in some way?
So
Very
overuse
important.
won't weaken it in any way, unless if you're very low in your nutrition level. That's why I said there's a very stark difference in what we see clinically in patient in terms of patient population in urban age group, population and the rural population, right? So in rural population, as you rightly said, there's a lot of stress going through the bone. But if the nutrition is not appropriate, that can lead to problems. But it's like a demand situation, right? You have to walk to school, right? You can't avoid that because that is
Exactly.
equally important for your life. And in urban population, you've got all the commodities for travel and available, but your nutrition is good enough, but you're not exercising enough, you're not walking enough to load your bones. So it's like similar issues, but different presentations in different populations.
Makes
And
sense.
also,
Correct.
in the tier three cities, lot of medical facilities are not available properly. Okay,
Yeah,
so if you can even mention, like urban way, we have all the facilities, correct? So
yeah,
apart from playing in the sun, जैसे बोलते हैं कि सुबह 8 बजे के पहले सन पे बाहर जाइए ताकि विटामिन डी
mm,
आए बॉडी पे नेचुरली.
yeah,
And unfortunately there's a lot of poverty also in India, right? So a lot of kids don't, nutrition wise, a lot of kids don't get the right, maybe इतना कार्ब खाओ, इतना प्रोटीन लो, इतना फैट लो, तो ये सब नहीं होता है. So what is that one simple basic thing which the kids can take, so that they can support their bone health? Because बहुत टाइम ऐसा होता है कि growing age पे they complain of pain. जब bone
yeah.
stretch होता है, they actually complain of pain. So what do you
Mm.
suggest?
Okay. So these are actually two different topics for now. In terms of growing pains, okay, a lot of adolescents, the moment they have their growth spurt, you'll find typically in the age group of 12 to 16, boys and girls will complain of, especially when they come back from school, or they complain of a lot of knee pain, back pain, shoulder pains. And oh, if they play for a simple sport, they go for a small run with friends or play around with friends for half an hour, they'll come back saying their knee is hurting. Most commonly, that is growth pain. So growth pain is basically because when you have a growth spurt, your bones suddenly start growing in height, but your muscles are trying to play catch up with that, right? So that's when you have sudden inflammation at the end of the muscle around when they insert on the bone. That's where you get inflammation over there. So they'll come at different joint pains at different places. And the best way to sort that out is rest. Rest for a few days. If it's hurting, you rest it out. And stretching. You need to do your stretchings because and that usually settles down once the growth phase is over. It's not like they're gonna come back with pain every day, but there'll be a small phase where they have pain, when it'll be okay because the muscle catches up. Then again the spurt happens, then they again have pain. But once the growth is complete, these issues usually sort themselves out. Yes, there are some conditions. Sometimes the pain keeps on increasing and increasing, and some people just ignore it. But if it's not settling with rest, if it's constantly increasing, or if you're having pain when you're sleeping, that's when you should seek medical attention because it can be something else as well.
Okay. Something else like?
Okay, now coming to you, something else like it can have vitamin D deficiencies. Okay, even vitamin D calcium deficiency, which can cause both disorders. You can have an infection, which is more common in the rural population. Okay, but so
Yeah.
that's why there can be multiple other issues, and that's why if it's not settling, don't just attribute it to growth pains and ignore it. If it's not settling, it needs to be looked at.
And when we are talking about stress, Dr. Chirag, there's
Mhm.
physical stress, but there's also mental stress right now with all of us, and especially adolescents with the growing
Absolutely.
technology or the peer pressure and everything. So, does
Mhm.
that mental pressure in any way affect the bone health?
Oh, significantly. So, the teenagers, especially nowadays, with the advent of social media, the virtual reality world, what we call it as, okay, along with family pressure of academics, school pressures, peer pressures of showing what you can do on social media, etc. So that causes chronic stress, which is not very vocal when it comes to Indian population. Right? We're not very open to discussion about the mental health issues or stress levels or what's happening at school. So you keep things bottled up. All that causes
Exactly.
increase in your like all our bodies have inbuilt cortisol, like steroid levels. Right? That's like a normal process of how our bodies work. So you have your inbuilt cortisol, what you call as cortisol levels. So chronic stress increases your inbuilt cortisol levels, which is inherent steroid levels, and this that causes absorption of calcium away from the bone. So that in itself can also cause reduced bone density.
Okay.
Wow. Really interesting to hear that how it's
Yep,
connected somehow, because this is
absolutely.
often overlooked. Like it's not connected to, it's always like if we say about like mental health or stress, वो सिर्फ दिमाग के बारे में होता है. We never
Absolutely.
look into और दूसरे क्या चीजें affect हो सकती
Yeah,
है हमारे body में. तो really
So
absolutely.
interesting to hear that.
And
yeah, the question goes to Disha. Did you ever check your
Yeah.
bone density?
No, I haven't actually, and
See,
I'm not very
so this
proud
is
to say this.
no, but this is very important. I mean, Chirag will also agree with me. Bone density is very important because coming back to why I asked this question is because my bone density is very weak. Anything happens, I break my either my wrist or my bone. And I was a kid, so wanted to ask Chirag especially on this. So
mhm,
my tarsal bone on my feet broke. You know the tarsal bone, right? The round thingy. I mean, I'm
yeah,
saying this for Disha to make her understand. So
yeah,
if you break a bone when you're a kid, so there was no operation, no surgery, nothing was there.
mhm,
But I was lying with my leg up for almost 3 months. You know, there was no
mhm.
movement, nothing. So when any kid, has a broken leg or a hand or feet or something, does this affect when they grow up?
So it depends on how it's being treated. Fracture, see, all of us have done mischief in childhood, right? None of us were saints. I have to admit that. But it can happen to anyone. It can be an unfortunate injury, it can be musty or whatever you call it. It can be a bad accident, it can be unfortunate. It's very difficult. So it's you can't really say that kids shouldn't have fractures. They will eventually have fractures. They'll play, they'll fall, they'll get hurt. But how you get it treated is the most important thing. Like, for example, in rural population, tier three cities, or people who do not have access to healthcare, what they'll do is they'll go to a bone setter, they'll go to a malishwala, okay, they'll do something, they'll keep it in a plaster or immobilized with some other lape or some other strap for months together, which is not obviously not the right way. And then they come to us because either the bone has not healed, your bone is bent, so they come to us with bent legs, bent forearm, bent elbows, and they're extremely stiff. Imagine a 14, 15-year-old kid with a bent leg, walking on a bent leg for months and months, can't go to school, has a stiff knee, can't bend, can't sit properly, all because they went to a malishwala because either they don't have access, or even if they have access, they prefer a bone setter over a doctor. In urban population, that is less commonly seen, but it is still seen. We still have a lot of patients who go to a bone setter first, in spite of being in an urban population in Mumbai, with a lot of access to healthcare, they'll still go to a bone setter and come back to us a few weeks later. Okay, this didn't work. Now what to do? And second thing, if in some cases, yes, you do require an operation, right? A lot of parents are actually scared. Okay, how can a kid have an operation? Yes, kids can have safe operations. It's not as big as an adult because kids heal very well. Kids have the fractures are usually not as bad as people get in adults. So yes, surgery is possible in kids. Not always needed, but sometimes a small surgery is required because we are not looking at short-term outcomes. We're looking at long-term outcomes. They're still kids, right? They need to go. They have a long way to grow, move around, and a lot of life left. So we need them properly aligned in a good bone quality, and we don't want them bent in any way that will
Yeah,
affect their function.
correct. Yeah. And now that you said that, Dr. Chirag, I actually went for a school visit this month itself. And उसी time पे I would like to share this a small thing कि वहाँ पे एक लड़की थी, maybe like 11 or 12 years old in class 6th or 5th, and her hand was clearly broken the last day. And the time we went, she was sitting like this the whole 2 hours I was there. And I could clearly see that her hand is broken, it's full. But फिर भी parents ने उन्हें घर भेजा है ये बोल के कि गिरा है सूज गया होगा, but they often, like you said, overlook and they just go to a malish wala or someone, and then after a while when the child, क्योंकि बच्चे भी खुद से बोलते नहीं है because of the fear of parents, that I
Yeah,
feel in rural geographic, if we talk about that. So that's actually really traumatizing physically also, and like we said, mentally also it affects another way until you get it tested by a doctor. So
yeah.
that's
So
actually really
I think, yeah. Coming to this, I think there's a myth. I'm just speaking about myself. I was wearing a stilettos, the heels, and I was just walking on the street, and there was a small stone which came underneath my shoes, and I was walking, so my leg just fell like this. Okay, and I cried of pain. And my parents were like, "No, no, nothing happened. Thoda moda hota rehta hai." So I'm not blaming them. I mean, it's a thing, regular thing. नहीं नहीं ये तो होता रहता है, पैर गिरता रहता है. That's when I tarsal bone broke, and I walked with that broken tarsal bone for almost 1 week. And that's when the leg started swelling, and I was crying out of pain, and they were like, no, no, something is really wrong. Let's take her to the doctor and get a X-ray done. So many a times X-rays also does not show you the correct fracture, right? Chirag, I mean, if you can tell me more on this, because कभी कभी क्या होता है, एक्सरे नहीं दिखाया, अरे कुछ हुआ नहीं है, बट कुछ हुआ है. So do you think those MRIs and everything should be required at that point of time?
See, X-rays will more often than not pick up the fractures, okay, unless they're like a very hairline fracture or they're around the growth plate. In adults, your growth plate is fused, right? So that area of the bone which has a growth plate is very clear. In kids, if the growth plate is still open, fractures around that's most common is around the elbow. So fractures around the elbow in kids, it's very difficult to pick them up unless they're badly displaced. If it's a very small fracture which is going through the growth plate, it's very difficult to pick it up because you have a growth plate and you have to differentiate towards growth plate kaun sa hai, fracture kaun sa hai. So that's when your clinical examination comes into picture. If you have a suspicion of a fracture, you treat it like a fracture, even if you can't see an X-ray. You can do 100 investigations, MRI kara lo, CT kara lo, you can do whatever investigation you want. But is that going to change your management? It's not. Right? You still need to make sure the kid is not in pain. You still need to immobilize the area to allow for the swelling to settle down. You still need to give them sometimes medication for the pain and swelling to come down. You're still going to do that irrespective of whether they do an MRI or a CT. The only thing that will change is how long do you keep the plaster for. And that the difference is usually 2 to 3 weeks. Whether there is a fracture or there isn't a fracture. So we don't commonly do that in kids, MRI or CTs, because CT has radiation. So we don't like exposing kids to radiations. And MRI is a lot of noise and vibration, so kids panic. Not every kid is comfortable with an MRI, and it's unnecessarily expensive, unless absolutely required. There are some conditions where you need it, where you're dealing with infections, when you're dealing with tumors, you need those investigations, but not in terms of straightforward injuries.
Okay.
And now that we're talking about myths, Dr. Chirag, in your experience, have you come across any myths in terms of teen health from your patients or maybe people from around you? And if you would like to bust few of them.
Yes, actually, I mean, a lot of people come to us saying, "Okay, what are you doing to take care of your bone health?" Like, "Oh, I drink enough milk." Okay, that is not enough, clearly, because dairy products can give you limited amount of calcium. They don't give you vitamin D. They don't give you proteins. So yes, milk is extremely important, but it is not the only thing that is important. You need to have adequate proteins. You need to have adequate sunlight or vitamin D. You need to have green leafy vegetables, because all these factors combined will help improve your bone health, and not just one factor in itself. Another thing, what people come to us saying that if I have a lot of calcium-rich food, I'll end up gaining weight. But what they don't realize is sometimes, yes, your weight sometimes can increase, but that is not your fat percentage. It's more of your bone density. If your bone becomes stronger, they become heavier, your weight will increase. You see a lot of that happening with elders who go to the gym, who work on strength training. Their muscles become stronger, their bone becomes stronger, their weight actually increases rather than decreasing. But that is more of muscle bulk and bone density, which is causing the slight increase in weight rather than your fat percentage.
Makes sense. Correct. And
one more thing is, sorry,
please
one more thing, what people think is that, okay, because I'm young, my bones can't go wrong. I only have to take care of them once I get older. That's not true. Because if you're in your growth spurt, if your vitamin D, your calcium levels, your protein levels are not adequate, you can develop deformities during your growth years, which can persist for your life, or if you don't develop deformities now, you are more prone to develop them during your later years of life. That's why this age group, you have to start maintaining things not for short-term outcomes, for long-term prevention as well.
And I actually wanted to ask you about this. Like, is there a test for adolescents to that they should do maybe like a yearly test or a half yearly test on their bone density, or
Mhm.
like what are the signs that they should look after to see that their bones are weak?
So I wouldn't recommend any test to be done on a regular basis because kids otherwise they are brilliant in terms of healing, recovery, and everything. So you don't need regular tests with them because they compensate and they manage very well. If you have symptoms, you should get tested in terms of calcium, vitamin D levels to make sure that that is not the main drawing factor. But bone density scan again is that's a lot of X-rays. So you don't necessarily need them in kids unless they are very symptomatic, which is not very common. So as long as you can pick it up early, if you know the warning signs, if you know the symptoms, see your pediatrician or orthopedic surgeon, get an investigate if required, basic calcium, vitamin D, phosphate level, basic blood test. Let's keep it simple. There's a lot of complications in life. Let's keep it simple.
Yeah,
And if something comes up which requires more investigation, yes, we can always do them. But I wouldn't recommend that on a routine basis.
makes sense. And what are like some of the warning signs to be very, like, if you had to put a
Mhm.
thing on?
Okay. So in terms of that, if people who have recurrent fractures, you'll have kids who go, oh, I have had 3 fractures in the last 3 years. That's not right, right? Because your bone quality should be good. If you're having 3 fractures in 3 years or multiple fractures in a year, something's not right. Whether it is an inherited quality of the bone, could be genetic, could be nutritional. That's when it will get looked at. Or people who have bowing of legs, abnormal swellings around the joints, or if you have short stature, suppose parents are quite tall, but the kid is quite short, right? Something which is abnormally different as come to your genetics. That will be looked at. A lot of teenagers come to us stating leg pain, pain in the shin bones, particularly after that of normal activity. Yes, if you run a marathon, you're having leg pain, that's a different story. But if you're walking for a kilometer, walking for half an hour, just moving around, going out with friends, you come back with leg pain, you need to get it looked at.
Makes sense. Great. And I think we have covered all of the pointers that we wanted to discuss, Dr. Chirag. But lastly, I would like you to give any advice to our audiences, maybe teens or parents or educators watching the live, that would be helpful in terms of the importance of bone health.
So I would suggest keep it simple. There are a lot of products you say, some people are going for artificial products and stuff. Keep it simple. There are a lot of good sources in diet. Make sure you have a good diet. Make sure you have good calcium intake, good protein intake, adequate sunlight, and simple exercises. I'm not saying go to the gym for teenagers. You don't need that. Simple exercises. If you practice yoga or meditation, if you want, if you prefer that, you want stretching exercises, you want to go play around with friends, go for a run, go for a jog, whatever you feel comfortable. But some form of exercise is extremely important. Early morning sunlight, just 15 minutes. I'm not asking to be in the sun, get tan for an hour. 15 minutes is good enough. Because I know all of us are busy. Even kids with schools, academics, they're very busy nowadays. So you shouldn't expect them to be out for so long in the morning. It's not practical. Just 10 to 15 minutes in the morning is good enough. And standard diet.
Yeah, makes sense. And anything specific that you would like to give to the rural audience that we cater to, because that is what Empower India actually work with. So if you would
So in
like
terms,
to tell something to them.
so in terms of rural population, the warning signs that I said, joint pains, abnormal swellings around the joints, leg pains. If you think your child is sitting with the humpback posture, like sitting with a bent back, get it looked at. If they're having significant pains, get it looked at. And if they have an injury, please don't go to a malish or a bone setter. You are inviting trouble. It can cause a lot of problems in the future, you'll end up subjecting them to multiple surgeries, long-term deformities, and long-term compromise in function, which you absolutely don't want in children.
Exactly, very true. So thank you so much, Dr. Chirag, for all the insights and tips and the myths that you have busted. So thank you so much for joining in. And I think we have unfortunately lost Sohini during the live conversation.
Yeah,
But no worries, these technical glitches tend to happen every time we go live. So we're used to it now.
we're
But
over
no
reliant on
worries. So
technology now, I think.
yeah, yeah. But anyway, so before we wrap up the conversation, I'm just going to let our audiences know that if you have found this conversation, very helpful for you, so you can stay connected to the panelists, that is Dr. Chirag, Sohini, and Empower India, and you can just DM them with all your questions. I hope they'll be, available to answer any questions that you have, and you can definitely go on and meet Dr. Chirag in person if you have any queries, and do let us know also on what kind of conversations that you would like to hear in the coming future. And in terms of Empower India, if you like these conversations and would love to support the work that we are doing with adolescents in rural Raigad in Maharashtra, then please do donate us through the scanner that is provided here. And you could also visit our website to know about the work that we are doing in different verticals for adolescents and for sanitation and women. So thank you so much. And any ending note that you would like to say to our audiences, Dr. Chirag, that would be great
So
if you want to.
thank you for conducting this, Disha, because I mean it's very important that that awareness is the most important thing. A lot of issues happen because it's not of lack of intent, it's lack of awareness. So you guys are doing a fantastic job. I hope you get a lot of donation from people and you can carry on doing such good work. And yeah, hopefully spread more awareness about different topics.
Yes, definitely. Thank you so much, Dr. Chirag. And to the audiences, we'll find you in the next Empowering Conversations by Empower India. Till then, take care and bye bye. Happy weekend.
Thank you. Bye bye.